Welcome to Advanced Dual Health and Life Coach Certification. Today we're going to discuss advanced wellness strategies, specifically coaching on mental and emotional impacts of chronic pain. Let's start with an introduction. Chronic pain is a widespread and complex health issue affecting millions of people globally. Unlike acute pain, which is a short-term response to injury or illness, chronic pain persists for months or even years, often without a clear physical cause. It can stem from conditions of arthritis, nerve damage, or persistent inflammation. And when ongoing nature, chronic pain transcends the physical influence mentally and emotional states in a profound way. Here are some key points of learning. Understanding chronic pain. To effectively coach individuals with chronic pain, it is vital first to understand that chronic pain is and how it differs from acute pain. The definition and duration. Chronic pain is defined as pain lasting longer than 3 to 6 months. Unlike acute pain, which is a protective mechanism that alerts the body to an injury or danger, chronic pain serves no adaptive purpose and may persist even after the underlying cause has been resolved. Psychological mechanisms. Chronic pain is often associated with dysregulation in the nervous system, where pain signals persistency despite the absence of active injury. Neural pathways can become hypersensitized, amplifying pain responses in conditions like central sensitization. Additionally, the brain may adapt to the pain over time, embedding it into the individual's experience. Take a moment to review the diagram below. Psychological mechanisms. The mind-body connection plays an integral role in chronic pain. Stress, anxiety, and emotional distress can exacerbate pain, while chronic pain itself can heighten feelings of a mental strain. The pain can act as a feedback loop where mental and emotional distresses feed into the experience of pain, making it worse. Associated conditions. Chronic pain can develop from identifiable conditions like arthritis or migraines, but it sometimes is without a clear cause. CFS, persistent fatigue, often coupled with joint or muscle pain, and neuropathy, nerve damage caused by burning or shooting pain. Mental and emotional impacts. Chronic pain affects much more than the body, and it often has a pervasive impact on mental health and emotional resilience. Mental health challenges, depression. Chronic pain increases the risk of depression due to prolonged limitations on daily activities and feelings of inadequacy. Anxiety, the fear of pain combined with uncertainty about persistence or relief, can cause or lead to chronic worry. And cognitive impairments. Clients may experience brain fog, a decreased ability to focus or think clearly, often exacerbated by sleep disturbances due to the chronic pain. Take a look at the mental health impacts on the right. Emotional impacts. Frustration and helplessness. Clients may feel powerless over their condition, especially if medical treatments fail to provide relief. This can cause anger and grief. Social impacts. Chronic pain can lead to isolation. For example, you might experience or see a client experience relational strains. Family and friends may not fully grasp the magnitude of their struggles, which can lead to feelings of misunderstanding or judgment. Workplace challenges. Reduced productivity or frequent absenteeism can affect job security. Coaching strategies for mental and emotional support. Effective coaching involves a holistic approach that addresses both the mental and emotional components of chronic pain. Active listening and empathy. Validate the client's pain and its influence on their mental and emotional state by phrases like, "I hear how overwhelming this can be for you. It's okay to feel this way." Recognize pain stories without minimizing the client's struggles. Take a look at the diagram of the 7 steps mindset coaching process. Cognitive behavior techniques, or CBT, help clients identify and reframe negative thinking patterns that perpetuate emotional distress. For instance, encourage a shift from "my life is over because of this pain" to "I am learning new ways to live meaningfully despite my pain." Use thought diaries to track triggers for negative emotions and adjust responses. Mindfulness practices. Introduce clients to mindfulness meditation to help them develop a non-judgmental awareness of their pain. Encourage a focus on breathwork during pain flares to reduce stress. Building resilience. Highlight examples of personal strength and past triumphs to build emotional resistance. Developing personalized coaching plans. Every client is different, and so are their needs. Tailoring a plan is essential to ensuring relevance and efficacy. Assessing needs and goals. Begin by asking reflective questions such as, what frustrates you most about the pain right now? What would you like to achieve despite your pain? This helps prioritize their mental and emotional challenges. Setting realistic goals. Design SMART goals to help improve sleep through mindfulness over the next 3 weeks or reduce feelings of isolation by attending a support group. By breaking plans into digestible steps, you reduce overwhelm and introduce adherence. Creating a personalized learning plan, take a look at the diagram below. Strategies for follow-through. Introduce measurable tracking methods such as a journal to document emotional states and coping mechanisms. Example coaching plan. The goal. Reduce social isolation by engaging with one new activity weekly. Actions. Week 1. Plan a call with a friend. Week 2. Attend a local hobby or meetup. Week 3. Reassess and adjust as necessary. Case studies and practical applications. Case studies demonstrate how coaching interventions can improve outcomes for clients. Case study 1. The scenario. A client might feel isolated due to a sickness and frustrated after withdrawing from social events. Coaching strategy. Encourage them to journal frustrations and join an online support group. The outcome, within 2 months, the client reported reduced loneliness and improved mood. Case study 2. A busy professional struggling with chronic joint pain had anxious thoughts about work performance. Introduce mindfulness techniques for calming anxiety during work hours. And the outcome, greater focus and reduced emotional distress at work. Case study 3. A senior with chronic back pain exhibited signs of depression. Used resilience building techniques, celebrating small wins like walking. What the outcome is, increased mobility, mood elevation, and improved sleep. Best practices for coaches, building a foundation for clients. Understand their pain narrative. Take time to learn how chronic pain has shaped your client's physical, mental, and emotional experiences. Ask reflective questions like, what aspect of your life have you most been affected by this pain? Validate without minimizing. Use statements like, your experience is unique, it's normal to feel this way. Avoid dismissive phrases like, it could be worse, which can make a client feel invalidated. Communication strategies. Listen actively. Focus on the client's needs by paraphrasing what they say to ensure understanding. Adapt communication styles. For analytical clients, provide structure plans and measurable progress markers. For emotional clients, emphasize empathy, personal reflection, and small emotional wins. Personalization of coaching sessions. Set client-centered goals. Base milestones on what matters most to the client. For example, if they miss gardening, create a gradual plan to reintegrate this hobby into their routine. And blend evidence-based practices. Integrate approaches tailored to different aspects of their condition, such as cognitive behavioral therapy for anxiety or mindfulness for pain awareness. And incorporate journaling exercises. Include emotional resilience building. Schedule sessions dedicated to learning self-compassion. Actions like listing 3 positive affirmations daily to help reframe negative self-perception. Progress tracking and adaptability. Regularly assess client experience. Revisit coaching plans every month and ask, is this approach still helping you? Measure progress not just in physical terms, but emotional improvement, like reduced feelings of frustration or better relationships. Number 2, introduce flexibility in goals. If a particular goal proves unattainable, consider alternatives that provide similar benefits like virtual meetings. Specific strategies to address common challenges. There's social isolation, depression and helplessness, and anger management. Review each of these within the slide. Case study integration for learning. Coaches can incorporate learnings from real-life cases to teach proactive strategies. For example, a middle-aged client struggling with brain fog benefited greatly from guided meditation paired with structured monitoring and morning routines. These adjustments provide clarity and enhance productivity over time. Encouraging self-accountability. Celebrate small wins regularly. Coaches must recognize each step the client takes toward progress, no matter how minor. Use statements like, yes, it's a small step, but it's a meaningful one. Look at what you've accomplished so far. Help clients take ownership. Encourage clients to become active participants in their often passive pain experience. Phrase it as, you have the power to influence how you respond to your pain. These are tools to help you take control. Educating clients beyond the session. Introduce resources. Guide clients towards relevant books, apps, or support networks that reinforce what you've taught them. Explain the why. Detail why certain strategies work for chronic pain. For instance, highlight how CBT reduces the pain anxiety feedback loop. And coach self-care to sustain client success. Tip for coaches, protecting your emotional energy is vital to maintaining your effectiveness for clients. Engage in reflective journaling or mindfulness techniques to avoid burnout for yourself. Here are some summary tables of what you've just learned. Types of pain. Here you have acute pain and chronic pain. Take a look at the definition, duration, causes, and impact on mental health. Table 2, mental and emotional impacts. Check out the impact type, the characteristics, the causes, examples, and coaching focus. Table 3, coaching strategies. Review each coaching strategy. We'll walk through an example. Active listening. The purpose, builds trust and validates experiences. The technique, reflective statements and open-ended questions. The example use, I understand how this impacts your daily life. Let's work on small changes. And the client benefit, clients feel heard and understood. Table 4, personalized coaching plans. Review each element, purpose, approach, example, and outcome. And Table 5, case studies and outcomes. Review cases 1 through 5 on this slide. Multiple choice questions. Question 1. What is the primary difference between acute and chronic pain? The correct answer is B. Question 2. Which of the following is not a typical mental or emotional effect on chronic pain? A. Depression, B. Anxiety, C. Improved cognitive focus, or D. Isolation. The correct answer is C. Improved cognitive focus. Question 3. A coach helping a client reframe negative thoughts about chronic pain is most likely using which strategy? The correct answer is CBT, option B. Question 4. Why is it important to tailor coaching plans to the individual needs of clients with chronic pain? The correct answer is B. Personalized plans make clients feel more understood and allow for flexibility to match their unique challenges and goals. And question 5. A client with fibromyalgia feels isolated from friends and family. What is the best application of coaching principles to support this client? The correct answer is B. Develop a gradual reintroduction to social activities, starting with low-pressure interactions.